Welcome to this mental health webinar. In this webinar, we're going to explore understanding our emotions and how to manage them. So a little bit about me. My name is Sonia Simmons. I'm a cisgender female, first generation Canadian. My parents immigrated from the Philippines in the early 1970s. I'm married with 2 teenagers and I have 3 cats. I've been working in the mental health field for over 25 years, first as a case manager, and now as a mental health counselor. I'm a registered social worker, and my main area of knowledge and experience is in dialectical behavior therapy. And I started working at Niagara North Family Health Team in February 2025. So the objectives that we're going to learn today in today's webinar is what are emotions? Why do we need emotions? What emotions do we feel? What is emotional resilience? Interesting ways to build emotional resilience, how to identify and express emotions in healthy ways, emotional boundaries and how to set them, how to manage really difficult emotions, and I will also provide a few resources that may also help you to better understand your emotions and how to manage them. So what are emotions? According to the American Psychological Association, emotions are defined as a complex reaction pattern involving experiential, behavioral, and physiological elements by which an individual attempts to deal with a personally significant matter or event. Why do we need emotions? So emotions serve 3 main functions. And this information comes from the DBT Skills Manual by Marsha Linehan. So first, it motivates action. So our brains are hardwired and automatic in our biology to survive. Each basic emotion has a specific function. So for example, fear functions in response to threats and aids in escaping danger. Anger acts when important goals or activities are blocked. Shame responds when personal characteristics or our own behaviors are dishonored or sanctioned by our own community. So in other words, every basic emotion gets us to do something whether we want to or not. Second, our emotions communicate to others. So we have different facial expressions and it communicates what we're feeling faster than words. So some facial expressions have automatic effects on others. So for example, smiling at someone makes us respond automatically with a smile in return. So have you ever walked down the street and noticed someone smiling? Then it makes you smile. Then you go into work with a smile and your coworkers notice you're smiling and start engaging in upbeat conversations about their weekend. So emotional expressions influence others whether we intend to or not. And lastly, emotions communicate to ourselves. Emotion signals us to pay attention to what is going on in a situation. However, there's a caution. Information on situations based only on emotions may not be accurate. For example, Bill immediately gets angry when he sees his wife talking and laughing with another man at a party and believes she's flirting, when in reality, Bill didn't realize the man was her cousin. So sometimes our emotions make assumptions or interpretations based on past experiences. If you often had personal experiences of being rejected by others, then someone who looks at their watch or glances away momentarily will make you think they're not interested, when in fact they may be just, looking, or maybe just thinking about when their appointment is next. So what emotions do we feel? This is an example of a feeling wheel. And as you can see, there are many adjectives to describe our emotions, but the inner circle basically names some common emotions that we all feel and then expands to describe those basic emotions with other adjectives, depending on the intensity of each emotion. So there are many different theories of emotions to explain how emotions are created. Some theorists argue emotions are biologically hardwired and automatic responses to stimuli in the environment. Other theorists argue different and specific physiological sensations create emotions. Overall, emotions are complex that include both physical and psychological states that influence our thoughts and behaviors. The range of emotions we experience also are influenced by our temperament, personality, and culture. So some theorists posit there are 6 basic emotions, while other theorists believe humans experience as many as 34,000 variations and degrees of emotions, probably hence why there's so many different adjectives to describe our emotions. A recent study from UC Berkeley discovered 27 distinct categories of emotions. Some of these emotions include anger, disgust, envy, fear, happiness, jealousy, love, sadness, shame, and guilt. There are varying levels of intensity and ways to describe these emotions. So what is emotional resiliency? Emotional resiliency is the capability to adapt to various adversities without detrimental and lasting negative effects on mental or physical health. Some people are innately resilient, meaning they are born with the ability to adapt to changes easily and less upset in stressful situations. There are some factors that influence our emotional resiliency, including age, exposure to trauma, and gender. Some traits of emotional resiliency include emotional awareness, perseverance, internal locus of control, optimism, support, sense of humor, perspective, and spirituality. So, for example, I have an older sister, and if there's ever confrontations, she's able to let go and carry on, whereas I can sit with my anger and frustration for a little bit longer before letting it go. So, essentially, she has a little more emotional resiliency than I do when it comes to feeling anger. There are ways to boost your emotional resiliency. So take a look at this picture and notice there are different ways to boost your emotional resiliency. So there's different ideas here, like embracing positivity, practicing mindfulness, accepting change, celebrating small wins. And as you look at this picture with different ways to boost your emotional resiliency, ask yourself, what am I doing to improve my emotional resiliency? Or what do I need to do more of to improve my emotional resiliency? So, for example, each morning after I wake up and have my coffee, I will engage in a mindfulness breathing exercise for 5 minutes, then do some light stretches. I will then sit with my to-do list and decide what needs to be done for that day. Then work on at least one important task. Before bed, I will write in my journal about my day, any difficult thoughts, memories, and feelings I experienced throughout the day, and write a couple of affirmations and what I'm grateful for. Here, I practice mindfulness, setting realistic goals, develop problem-solving skills, and celebrate small wins and practice gratitude. This graphic is just an example, though, so be creative and find some healthy ways that work for you. To expand one of the ways to boost emotional resiliency, taking care of your physical body is just as important as your mental well-being. The way to remember this is using the acronym PLEASE. An out-of-balance body increases vulnerability to negative emotion mind. So the PL is treat physical illness. Being sick lowers your resistance to negative emotions. The healthier you become, the better you will be able to regulate your emotions. The question to ask yourself, if I'm resistant to fearful, or if I'm resistant or fearful to see my family doctor for pain or sickness, what is getting in the way to treating my illness? Balanced eating is the E. So eating the right amount of different types of food will help you feel good. Avoid excessive dieting or emotional eating as it can increase your vulnerability to emotion mind. A question to ask yourself, which foods make me feel good and energized? For example, a rich hearty soup with a multigrain bun. And which foods make me feel irritable and lethargic? So for example, too much coffee, too much sugar, fast food. If the latter, be mindful of eating these foods in moderation. So next letter is A, avoiding mood-altering substances. Alcohol and drugs, like certain foods, can lower resistance to negative emotions. Stay away from mood-altering substances. A question to ask yourself, how do I behave after I consume mood-altering substances? The S is for balanced sleep. Try to get the amount of sleep that helps you feel alert and good. Try to keep a consistent sleep schedule. A question to ask yourself, what things do I do that helps me to get a good night's sleep? What things do I do that make it worse? And the last letter is E, getting exercise. Any form or type of physical activity, when done consistently, is like a natural antidepressant. A question to ask yourself, what physical activities do I enjoy doing on a regular basis? So for example, cleaning the house, dancing, going for walks, yoga, or exercising at a gym. So how to identify and express emotions in healthy ways? So if you're ready to connect with and embrace your emotions, then here are some ways to express them in healthy ways on your own. First, you need to find a comfortable and safe place to sit or lay down. You can have your eyes open or closed. So notice what sensations, urges, thoughts are showing up in the moment. Notice your body language and facial expressions. Be curious about what you're feeling. Acknowledge that it's okay to feel what you're feeling. For example, I noticed I'm feeling sad and my eyes are welling up with tears. My shoulders and chest are hunched down. I feel like crawling up into a ball and crying. I'm noticing I'm missing my father who passed away years ago. Be non-critical, non-judgmental about your personal experience. Be kind to yourself for having positive or negative emotions. Name to yourself or out loud what emotion or emotions you are feeling. Describe in as many words as you can come up with about how this emotion or emotions are affecting you. Allow to give yourself permission to sit with your feelings for as long as you feel comfortable in doing. And if it helps, place your hand over your heart as a way to be compassionate towards yourself for experiencing your emotions. And then lastly, thank yourself for allowing yourself to go through the experience. There are also healthy ways to express your emotions with others. One of the ways is to communicate to others your emotional boundaries. What are emotional boundaries? Emotional boundaries are personal limits of what you will and won't accept in a relationship to protect your well-being and self-worth. How to set healthy emotional boundaries. Identify who you have difficulties setting boundaries with. So this could be a loved one, a friend, another family member, somebody in the community. Identify what are your triggers. For example, the person appears helpless and powerless, person stares at a similar or shares a similar traumatic experience and you want to save them. Victim mentality, emotional sensitivity, etc. Identify what is blocking you from detaching from the other person. So for example, is it culture related, sense of responsibility or obligation, feeling the need to be in control, trauma bonding, etc. Take action to break down barriers. And if needed, get support from a mental health professional, a trusted friend or family member, or it may be learning effective communication skills. And practice grounding exercises to help you maintain boundaries. For example, mindful breathing, self-soothing activities, visualization, 5, 4, 3, 2, 1 with senses. And remember, it's okay to look after yourself. Build self-care and self-compassion. Now, if you have really, really difficult emotions and it's very hard to manage them, here are some strategies on how you can go about doing that. So you can ask yourself, am I too upset to use my regular coping skills? Am I struggling to solve my problems in the moment? If your answer is yes, practice mindfulness of current emotions. Or you can ask yourself, are my emotions way too high and intense and have strong urges to engage in problem behaviors? If the answer is yes, practice tip skills. What are these skills and how do I apply them? Check out the next few slides. So mindfulness of current emotions means observing, describing, and allowing emotions without judging, inhibiting, blocking, or distracting from them. Why use this skill? To learn that emotions are not catastrophic, to feel less controlled by your emotions, to decrease suffering, to accept painful emotions as a natural part of our human experiences. So how would we go about using this skill? So first, you need to observe your emotion or emotions and acknowledge its presence with I statements, like I notice I'm feeling sad, or I notice I'm feeling angry or frustrated. And choose to experience this emotion as a wave. So allowing this emotion ebb and flow and go through you. Also, pay attention to any physical sensations. So you might notice something in your chest if you're feeling sad, or you might notice some muscle tension when you're feeling angry. Remind yourself you are not your emotions. That is really important. Emotions are biologically hardwired to feel, and we are all designed to feel emotions. It doesn't define us as human beings. Practice respecting your emotions. Practice willingness and acceptance of the emotion, letting go of judging your emotion. So, for example, Tom just had an argument with his manager about deadlines. Tom leaves the office angry. Tom decides to go and sit outside in the fresh air to cool off. Tom has urges to quit his job. Tom decides to focus his attention on how he's feeling. Tom observes muscle tension in his arms and hands. Tom can feel his heart beating in his chest. Tom can feel his face and ears are hot. Tom observes his facial expressions. Eyebrows furrowed, mouth scowling, gritting teeth. Tom reminds himself that he's allowed to feel angry and that he is dedicated and hardworking. Tom takes a few deep breaths and realizes that him and his manager both want the same outcome, but have different opinions on how to meet the deadlines. Tom decides that his anger is telling him how he wants to reach the deadline in a timely manner and goes back to talk to his manager in a calmer state to review options. Tip can be very effective when you're overwhelmed by your emotions. Depending on the intensity of the emotion, you may have to repeat as necessary or switch to a different skill until you notice the intensity reduces to a manageable level. So there are 4 skills in TIP. So the first letter, T, is for tip the temperature. Why this works. So cooling the body slows your heart rate and breathing, shifting the attention away from intense emotions and intrusive thoughts. So how to go about tipping the temperature? You can go to a sink, run the cold tap to as much as you can tolerate. You can plug the sink and fill the sink with that cold water. You can gently bend at your hips and allow your face to be immersed in the cold water, feeling that cold temperature while holding your breath, and then standing back up, and repeat as necessary. Some other options is to take a cold shower for as long as you can tolerate, just to notice that cold temperature and shift in intensity of emotion. Apply a cold ice pack on your skin. Some people apply it on the face, around the cheekbone area. Some people like to apply on the back of their neck or the top of their chest, wherever you feel comfortable and wherever you find it's helpful. Or you can run a wet cloth, a cloth under the sink, get it wet and cold, and apply that to your face or neck. I is for intensive exercise. So intense exercise lowers stress and increases that feel-good brain chemicals like endorphins. So this intense exercise, the way to use it is to, invigorate your body for quick bursts and physical activity, like briskly walking or jogging, doing jumping jacks, doing air boxing, riding a bike, but you want to only do it for a short time, but very quickly. So around 50 minutes is ideal, but also being careful not to overextend your muscles or overdo it to the point of injury. The first P is paced breathing. So paced breathing increases oxygen intake and lowers blood pressure and heart rate. So the idea is to slowly exhale and then a normal inhale. So you want to inhale through your nose for a count of 4, hold your breath for a count of 7, exhale through your mouth for a count of 8, and then repeat several times until you notice a difference in the intensity of your emotions. And the second P is progressive muscle relaxation. So tensing and relaxing muscles helps the body let go of stress, triggering the relaxation response. So you can sit or lie down in a comfortable position. You can start from the head down to the toes, but you want to just focus on one muscle group at a time. And you want to tense that muscle for a few seconds, noticing the tension in that muscle, and then you want to slowly relax that muscle as you say the word relax. So you can repeat those steps with different muscle groups in the body, and try not to tense too much to the point of injury, but just enough to notice the tension, and then making sure that you relax fully in that muscle group. And if you have trouble, that's okay. Consistency with practice is important. So, interested to learn more about understanding your emotions or healthy ways to experience and express your emotions and or manage really difficult emotions, please contact our mental health team at Niagara North Family Health Team. And here are some resources. So you can copy and paste some of these YouTube videos. They range from explaining about emotions to giving more information about using some of the distress tolerance skills. And there are a few books as well that also tap into understanding your emotions and ways to manage them.